Hi everyone, welcome to Center of Balance Live. I'm Sinanpua from Center of Balance, the acupuncturist. Now, today our topic is what is the long-term outlook for people with stable angina. Well, that means what would happen if you suffer from stable angina, you were in treatment, and what would be your expectation? What would happen if you keep doing whatever you do? You see, so we're gonna discuss this today. Now, let me just share on my Facebook first. Hi Veronica, how are you? And Eric, nice to meet you. Thank you. And I'm going to my Instagram to post on my Instagram as well. So I have two Instagram accounts. So one of them is on live now, but I'm just trying to get into the other one set up. And so I have two different platforms that go online as well. Okay, that's it. Okay. The long-term outlook for people with stable angina, right? And it's actually generally good. Why is that? Because stable angina is you exercise and you had an episode, or you know that if you get emotional, you're angry, then you get it, you suffer from it. Then which is compared with unstable angina, you don't know when you're going to suffer from it. You don't know when you're going to get an episode. It can come anytime. So with stable angina, you know it. You know what's going to trigger the angina. So the outcome is better. It's good compared with unstable angina. Okay. If the unstable angina, you can't control it, you don't know when it's going to happen, then the outcome's not as good. Because it can happen when you sleep, it can happen when you walk, it can happen when you have a shower, any time, any days, in any situations, it may happen. So that's what we call it unstable angina. So that is not very good. Not very good. Okay. Let me just right. Okay. Let's keep going. So the conditions often improve with medication that we talk about it, the medication that you use when it happened. Okay, is the nitroglycerin. Then that is the most common one. But for the long-term one, you may take some high blood pressure pill, high cholesterol pill, or bless me, and diabetes pill, something like that. And we mentioned that those things are for long term, that you try to control all these things to prevent angina, but it doesn't really work. So all this long-term chronic disease pill that you're taking, it actually those diseases form the diet, the lifestyle. Okay, now making certain lifestyle change can keep your symptom better. Okay, so in what way maintain a healthy weight. Oh, this is important. Healthy weight. Now, for stable angina, if you ask patient, oh, hey, you got stable angina, you should keep regular exercise. But if they can't exercise, because once they get exercise, they get angina. There's no way to ask them to get exercise. So it maintain the healthy weight is mainly through diet. What you eat, right? So again, we discussed that 2 days ago. The best diet for angina is plant-based. It's plant-based, and it can help you lose weight. Okay, exercising regularly, it may help, but you need to look at the intensity of your exercise. Right? Yes, if you just go for a walk, and that's fine, but not weight. You know, people get weight. We could go running, so that may be too much for you. So you need to know your limit. Okay, of course, avoiding smoking. Smoking is not good. All the chemical things go into your blood, and now when you get stable angina, that's because you lack of oxygen, and those things into your blood, you get even less oxygen. Not to say that when you smoke, it actually lower your function of your lung, and if your lung function is lower, it can't get enough oxygen for you. Okay? Now, eating a balanced diet, we talked about that already. That is the best diet of plant-based diet that I suggest you to change to. Okay, this is just as important. All right. Now, you may continue to struggle with chest pain, angina. If you are unstable to transition to a healthier lifestyle. Right. Now, it really means that if you have an unhealthy lifestyle, then the chest pain is keep going, even you on the pill for the diabetes, high blood pressure, high cholesterol, because none of them can prevent you get rid of the stable angina. None of the pill will do that. Okay, so to get rid of it is you to your lifestyle, right? So if you're not controlling it well, you're not changing your lifestyle, you keep going, or you have a surgery, or you have a bypass, or you have stent in your heart, then you feel great and you keep going back to working long hour every day, very stressful life, and not changing your diet, and you keep taking consumes the same diet as it was, then what's gonna happen? Right, this absolutely will increase the risk for other types of heart disease, which is possible complication of stable angina that include heart attack, sudden death, like abnormal heartbeat, right? And it might go to unstable angina, which means it can change if you're stable angina. If you're not looking after it, you keep whatever you're doing, this will change to unstable angina. And unstable angina, you don't want to get this because you don't know when it's going to happen. Okay, right. So it is important to call your doctor as soon as possible if you experience any sign of stable angina. Okay, this is very, very important. All right. So the outcome, the outlook, the long-term outlook, if you are stable angina, it is good in general if you change your lifestyle. If you just rely on medication, I'm sorry, that's not gonna work. You're gonna turn to getting worse, change to from stable angina to unstable angina. That makes sense. Okay, that's it for today. This topic is just telling you this message. This is important. Again, the long-term outlook is about when you suffer from stable angina, whether you take actions for changing your lifestyle or not. If you change your lifestyle, everything stable down, and you don't get angina, or make an effort to change your diet and to get rid of your high blood pressure, high cholesterol, high blood sugar, then therefore your outlook, long-term outlook, will be good. Even though you stay in a good diet, but if you on those pills, you still have very high chance to increase the possible complication of stable angina. Okay, does that make sense? I hope that makes sense to you. Okay, Happy Day asked me that what is the strategy to lower high sugar level. I replied you in the private message already. Is Magical 8, Magical 12, Magical 8 plus 12, and those are the strategy that can be for high blood sugar, but those are not the only strategies, because there are many ways to treat. They are just two things that I may use for high blood sugar. Okay, and again, lower high blood sugars, you can simply through change your diet, sometimes without medication, without Chinese herb, without acupuncture. So you need to know, you need to understand the power of changing diet, the power of plant-based diet. Or some people do fasting, and that help a lot with lower the blood sugar. But the patient is weak. What does it mean the patient's weak? The patient is weak doesn't mean that they can't change the diet. All right, and the patient is weak, sometimes acupuncture is not good for them, because according to Huangdi Neijing, not every patient can get acupuncture. If weak patient, you give them acupuncture, they become even weaker. If they feel more lack of energy, the energy is lower, they feel very tired. If they go for sleep and they get better, and that's pretty good, it's okay, you can still do acupuncture. If they go sleep and they feel the energy still very low after acupuncture, that means this kind of patient not good for acupuncture. And what do you do for them next? Chinese herbs. So I know that when you go to acupuncture school or whatever you do, you must have no one has been telling you that acupuncture, some patients that you can't treat by acupuncture. Everyone just tell you that, hey, acupuncture can do everything. That's not true. So according to Huangdi Neijing, if your patient's weak, qi, blood, yin, yang are all deficiencies, and for the outlook are very all deficiency, and Huangdi Neijing said, do not needle. Give them herbs. Wow, this is Huangdi Neijing. Now, if you try scalp and it helped her, that's great. That's great, and keep going forward. Keep going forward. Okay, So you have, we normally do acupuncture with patient 3 times or 6 times to try it out how they respond to acupuncture before we set up a long-term plan for them. So this is important to get in. Okay, so again, for blood sugar, there are many strategies, and I keep saying again and again that when it comes to blood pressure, blood sugar, high cholesterol, you need to tell your patient and let your patient know this is not just doing acupuncture to treat them for their diabetes, high blood pressure, and cholesterol. We need to work together. Work together means they should do some acupressure point at home. They should do a diet change. Right? Does it make sense? So this is important. If you're trying to get your patient rely on your treatment, on your acupuncture technique, on your Chinese herbs, doesn't matter how good you are, you're gonna end up with Western medicines. Pretty much the same, because you're going to just tell your patient, lead your patient to changing Western medicine to Chinese medicines, because they have to take the Chinese medicine for the rest of their life. And this is trying to replacing the function. It's not trying to restore the function. But we are talking about restoring the function. We are talking about to refunction all organs. Now, restoring all organs is looking after everything. When your organs function is better, then your body will heal itself. Okay, what is the best diet? Okay, I keep saying it in my live video, the best diet is plant-based diet. It's vegan diet. And the book, The China Study, and everyone should get it and read it. If you keep watching my live video, I've mentioned it many times already. So I recommend the China Study and plant-based diet. And when you come to plant-based diet, then you need to understand, you need to get the information, not by just listen to me or watch my live video. This information I consider is not good enough for you. You need extra, you need more. You need extra, you need more. Then you need to go and get the China Study and read it yourself and understand it, why plant-based diet are the best diet for everything, for the diabetes, for stable angina. Okay, even though my patient, I suggest them to read this book. Really, I suggest them to read this book. Only when they read this book, they understand it, then they start to change. Okay, so I hope this helped. That's it for today. If you have any question, please leave your question down there, and when I come back and when I look at it and I know what's going on, and I'll give you an answer. Yeah, no one diet fits all, right? Yeah, that makes sense. That makes sense too. Yeah. So when you go to very beginning and you look at what do you need diet for, then you understand that, because when you say no one diet fits all, it seems to make sense, because in our knowledge we are talking about, we first got knowledge you have to eat meat to get a lot of vitamins, calcium, protein from the meat. Then when you study Why no meat? Why no animal protein? And what would that harm your body? Then you start to choose. You break it down. What do you need from the diet? Then you think about the plant-based diet. Can you get everything from plant-based diet? If the answer is yes, then when you change to it, it's easy for us to say no one diet fits all. It's a theory, but try to go in and understand it, the vegan diet, the idea of it, and try to change to it and feel it. I'm pretty sure you will face some issues like, oh, I feel a bit tired, or I worry about this, and I start to get blah blah blah, you know. Then we'll be able to discuss even more. Right. So if you say what no one diet fits all, what does it really mean to you? Why do you see this? And I want to understand that. Because you may think of something that is very differently with me. Okay, so I'm here to encourage us to be an open mind, to try a lot of things and read the China study, and you know, not one diet fits all. Party is right, party is not. Okay, so I'll share with you next time, and if you have any more questions, and I'm happy to discuss this with everyone. Okay, stay awesome, and I love you all. Bye bye.